Hi, I'm Dr. Christopher C. and welcome to this audio summary of the muscles of the shoulder. We'll talk about deltoid, the rotator cuff and teres major, covering their origin, insertion, nerve supply and blood supply, as well as their simple action. The four muscles of the rotator cuff are Supraspinatus, Infraspinatus, Teres Minor and Subscapularis. Supraspinatus lies above the spine of the scapula in the supraspinous fossa and inserts into the greater tubercle of the humerus. It is innervated by the suprascapular nerve from C5 and C6 and supplied by the suprascapular artery, a branch of the thyrocervical trunk. It initiates limb abduction to 15 degrees. Infraspinatus originates in the infraspinous fossa and also inserts into the greater tubercle of the humerus. It is also innervated by the suprascapular nerve, but is supplied by both the suprascapular as well as the circumflex scapular artery. It laterally rotates the upper limb. Teres minor arises from the lateral border of the scapula and inserts into the greater tubercle of the humerus. It's innervated by the axillary nerve from C5 and C6 and supplied by two circumflex arteries, the posterior circumflex humeral artery and the circumflex scapular artery. It also laterally rotates the upper limb. Finally, we have Subscapularis, which arises on the costal side of the scapula in the subscapular fossa. Unlike its colleagues, it inserts into the lesser tubercle of the humerus. It's innervated by the upper and lower subscapular nerves, both from C5 and C6. It's supplied by a large branch of the axillary artery, the subscapular artery, and its action is to medially rotate the arm. Nearby, but not part of the rotator cuff, is teres major, arising from the lateral border of the scapula inferior to teres minor. It inserts into the intertubercular sulcus of the humerus and is innervated by the lower subscapular nerve, that's C5 and C6, and it's supplied by both the subscapular and the circumflex scapular artery. It adducts, medially rotates and extends the upper limb. Finally, we have deltoid, which has a rather large origin from the lateral clavicle, the acromion and the spine of the scapula. This inserts on the deltoid tuberosity of the humerus. Innervation is from the axillary nerve, that's C5, C6, and it's supplied by three branches from the axillary artery, the thoracoacromial, the anterior and the posterior circumflex humeral. Its action is abduction as well as flexion and extension. That's all, thank you and see you next time.